You're listening to the podcast between doctors and friends. Here's to another episode of Between Doctors and Friends. Our co-host here is our Dr. Ray, an OB-GYN, and Dr. Foz, just some doctor.
Yeah, I'm some random person off the street. I'm not actually a doctor. I've just been playing one on TV, and you guys don't even know about it.
There you go. There you go.
I just make it up as I go.
And we have in the audience here is Auntie.
Hello, everyone. And Dr. Foz, I would actually beg to differ because no actor talks about hypertension like you do.
Oh, that's my jam.
That's your jam. I think that's what
Everybody,
we'll do.
control your blood pressure. Thank you.
That's what we'll do next weekend. But how has your week been? Today is spring forward, so we are recording an hour earlier than our bodies are used to. Let's start with Dr. Ray.
I had a tough week, to be honest with you. Some work stuff came up that was very disappointing and devastating with one of my colleagues giving me some information, and it kind of made me very sad and depressed for the rest of the week. And just some personal struggles been going through, and but try and keep my eyes on the future and know that, whatever I'm going through, it will pass. I learned of some deaths of some people, and that kind of always puts it in perspective. And so, you just week by week, day by day, life is tough, for everyone. So I think there are a lot of people struggling right now. And so you can kind of add me to that list for this week.
We send you our love, Dr. Ray.
Thank you.
We will talk about
We're here
that.
for you.
I'm sorry for the news, and really, we'll go dive deeper into that. It is persevering.
Yeah.
That.
Yeah, I think if you make a list of every bad thing that you've gone through in your life, you'll be amazed at how you were able to live through all of those problems and issues and how you survived it. But I think that's just human nature. We just keep going. We keep living, I think it's the hope for tomorrow is that's going to be better, or that there's going to be, a rainbow at the end of the storm. I think that that's just human nature. And as it becomes more and more difficult with life, it just seems to be, the resilience of the human spirit, so to speak.
Yeah. Yeah.
It's funny that you mentioned that. I walked in on somebody watching the Hunger Games series. And did you guys see that?
Yeah.
I think I saw the first one.
Okay, it was. I don't remember which movie it was from. It was from one of them. I think I've seen them all, but I don't remember them well. And it was a scene where Donald Sutherland, I forgot who he played, somebody in charge of somebody, was talking to one of his minions, and he was basically saying, like, hope is stronger than fear. The only thing stronger than fear is hope, and you have to crush their hope so that, we can take control of what we're taking control of. I don't remember, but I just remember thinking that's actually quite true and very profound. So there's hope, right? That you can get through things, and that gives you the motivation and the ability to get through those things.
Wow. I mean, this is a podcast of between doctors and friends, and what do we do? How do we cope when we deal with loss?
That's complicated.
Yeah.
Yeah.
I think it changes and depends on everyone. So, I mean, that's a long topic that,
Yeah.
I mean, if we want to get into it now, we can. But I think I think everybody grieves differently. Everybody takes their own time in managing all their emotions and their responses. And, there's no time limit on grief. I have patients who unfortunately lose their pregnancies, early miscarriages, miscarriages when they're 5 or 6 months along, and even full term, they're 9 months and expecting a baby any day and experience a sudden loss. And I try and counsel them that, it will take as long as it takes for you to get over this, and you will truly never be over it. You will still think about it every single day, but as time goes on, the pain lessens, the crying lessens, and at some point you'll be able to think of the loss and not feel the incredible pain that it's causing at this time. So grief is just very different for every person.
I'm glad you brought that up, Dr. Ray, because, before we started this recording, I was just thinking that, you're both of you and all the doctors, in the world, your job is to help people stay alive. Your job, especially Dr. Ray, you're basically in the sector of new life. And bringing this up, you do deal with also loss of life. And that's just made me kind of think a little bit deeper here.
Yeah. It's hard. It's very hard, because the loss is really tough, and it's really hard to tell a patient that, that they've lost their pregnancy. But, you do it with as much empathy and kindness and sympathy as possible, and, answer, all the questions as much as they need you to, and answer the same questions over and over again because they need you to.
Yeah. Different. I mean, and I don't know, like, I didn't really get any training in, like, how to tell people bad news per se. Like, I mean, I think I did, but not, like, it was more like how to talk to people about important topics, and that would fall into it. And, like, one of the things is like, it's, it's a good idea for the patient to have somebody with them, a friend or family member, because when they're being given news that's potentially very impactful or devastating, that they're not always hearing everything you say. And I have to tell you that I don't think they hear everything what I say, even when it's not something like that, And it's like the stress of being in a doctor's setting and all that stuff. I think just it goes in one ear and out the other sometimes, more so for some people than others. But it's I felt like, at least in my experiences, and this might be different for Dr. Ray because we trained to different places and are different specialties, that, like, it was just kind of like you learn it on the job as you go. It's not like I had tons of people, like I was standing there watching them do it, because it would often be, being somebody who wasn't usually taking care of somebody who was losing, like, a pregnancy right then and there, I often did experience those things as a provider as well, but, like, it's not something I did and certainly not do anymore, and nor with the same degree of frequency that Dr. Ray has to do. It's a lot of times, like, the news is already spread, or it's just, I don't know, it was just sort of weird. I don't think there was any, like, you just sort of have to figure out your way, and then also just using some common sense, and also the whole do unto others as you would want others to do unto you,
Yeah.
which is like, how would you handle this if this was somebody dear to you, and how do you support them, and And then you also have to have like a certain degree of objectivity as well, because you have to make decisions for them and move things to where they need to be. And you can't get too caught up in it as well, because that is also emotionally taxing for the provider.
Mm, that's true. So,
I think that went through
I'll
transition with
share.
the
Yeah, I mean, I'll share that. Last week we were talking about doctors and vets, right?
yes.
And yesterday,
You don't have to talk about this. We can move on to another topic.
no, it's okay. Actually, I could trim this part, so. No, yesterday, so I had to put my dog down.
Yeah.
No, I'm so sorry. And
And that's part of what kind of put some of the stuff that I was going through into perspective, because, we have loved ones in our lives, and when those loved ones leave us, that's all that really matters. I'm sure you would, give up any amount of time or money or personal possessions or jewelry or whatever it is that you have to have time with your dog or your loved one. So, and then, you shared with us that a family member's friend passed away as well, a younger person.
Yeah.
And, it just puts things into perspective, that all of the hardships that we're going through, all of the pain and everything that we're going through, as long as you have your loved ones and your family, that's all that really matters.
Yeah. I mean, I actually woke up, when you're caring, you have to, and I've experienced this, recently. But, waking up, I think out of exhaustion, and, everything happened fast for my dog, which is, in a way, I look at it as a blessing.
agreed.
The downfall happened maybe like Tuesday, Wednesday, and then it just kind of kept declining. And so I woke up. I said, okay, if we'll you know, take the dog to like a second vet, because I was waiting for the primary vet's test results. But I said, if things are basically terminal, like, I'm gonna make the call. And I kind of approached it in a, like, with strength. I just made that call. I said, okay, today's the day.
That's love.
Yeah.
That's love. That's strength, but it's also out of love.
Yeah. Yeah. And in fact, like, like, you're kind of going through that and that mode of like, gonna do A, B, and C. First, you gotta call around. Do you take it to the
Isn't it
vet?
awful?
So,
It's
so
awful.
we're talking about, pets. And I said, no, I don't want to take it to, it's just like we went to the vet and like, no, 11 o'clock, cancel that. I want to do it at home. And then calling services, like the services that I've used in the past. And it's, it's kind of like, I think it was like 8:30 in the morning, and, they're not answering. So leave a voicemail, call the other services. Oh, wait, I want to get coffee first. And, you go through that searching. So I actually was not, um, my frame of mind was just kind of to get things done. And
It's okay.
then,
There are things that have to be done, and so kind of going into action mode is protective of your psyche.
yeah. And this is probably what I'm like, this is probably what you guys go through as well. You're just getting things done. And then out of like making the decision, our usual, what would you call it? What is like a hospice vet or what kind? I don't know what the
Home
in-home
euthanasia.
vet, huh?
Yeah, like there's it's home euthanasia.
Yes.
Yeah, and I yeah, I think I have also had to avail myself of those services. I actually know of a great local resource for me here, and unfortunately, it's out of the region for you.
Mm-hmm.
Otherwise, I would have recommended it. And I also am terrified. The vet who runs her home euthanasia services, really a very nice, like very compassionate person, and I am terrified that she retires.
Yeah, I mean, I'm going through it, and I'm thinking to myself, I mean, I've gone through it 3 times in the last, I'd say whatever, 8 years. Um, they come, and I said, okay, they happen to just call, and goes, okay, let's do it. Let's do it at, like whatever, noon, whatever, or 1 o'clock. And so I said, okay, I'm gonna take my dog for his last ride. He loves, you know,
Oh,
uh, road trips. And then I think at a certain point, he's just like, I'm over it. And you kind of just like, you really have to gauge, as a dog owner, I tell myself and I tell my friends, you have to do it for them because they can't make that decision. And it's going to be a game of who can last longer, whether you're exhausted or the dog will just keep staying alive, you know. And, but long story short, the vet came and I was like thinking to myself, what a job. That's her, she, oh, Dr. Ray, is that your phone?
It is.
That's a cool ringer. But then I even told her, I said, hey, you know what? We podcast, we were talking about vets. Can you come to our show? And,
You know,
I
why does it sound like a pager?
did you really say that?
what?
Oh, I think that's kind of cool. Like, I mean, that tells me that you're kind of accepting of what was happening, and that's
Yeah,
unfortunately that's what has to happen. It's
I,
like what happened had to happen, as crappy as it is.
I think she was a little bit thrown off because I kind of, coming to the house and, I was kind of, I was accepting of it. I was just, this is a process and I know how it is. And you're going to give the first shot and my dog's going to go to sleep and then you're going to give the second shot. And I just started talking to her about like her job, like what she does. And she's like, yeah, I used to, like go to the clinic but now I'm doing this and, it can be tough. And I'm like, I want to invite you to our podcast. But, it was very much, of course, it's without, I spent the moments before she arrived and I had my tears. I gave, I said my goodbye. But really, for me as the pet owner for this, I call him my perfect dog. It was time, and I
Yeah, he
didn't
was
want him to
pretty
suffer.
old. He was pretty old. I mean, and I think the beauty of this is a couple things. Is he got to be his last moments were with his loved ones in his home and not scared, somewhere else. And that he also lived a really long life. Like he lived his lifespan. And not everybody or every pet is so fortunate. And like, if when I go, I hope that's what I get to do too. Like I get to die at home with my loved ones and I get to have lived a very long lifespan with
Yeah,
like a good quality of life until the very, very end.
yeah, yeah. And he like my memories of him is like just like last Monday, just still jumping around, up and down the bed, up and down the couch, and he was really, good. And the important discussion I had with my vet is, my dog had a liver failure. And I said, my vet actually said, you know, he will die, but it's painful. and he'll
Oh,
probably last a few weeks, but it's going to be painful for him. And that in itself was my trigger. I said,
of
okay,
course.
we'll make a call because I don't want him to be in pain. And to have the vet, kind of go through this, and I kind of asked a bunch of questions, and I thought I was hosting a podcast. Um, and I said, it was kind of I said, I have to let my dog, who was so good.
It was. It's a really, really. I've met your dog a few times, and your dog was a really nice dog, like really cute and really obedient and really like um a good disposition. Really nice
Yeah,
dog.
yeah. And it's just a dog, right? I'm just like, God, it's just a dog.
Nope, nope,
Eh,
not just
No,
a
that's
dog. It's a
family.
family member. A family member.
honestly,
It
like, I mean,
was really
my
nice.
disposition was like pretty strong yesterday
I know.
until I told her. She's like why I'm, I had my head over my shoulder. I said because of what happened to me, losing a sister.
Yes.
And
That's
the vet
okay.
cried.
Well, it's a sad situation. And a lot of people have hearts too. Not everybody's cold-hearted and doesn't care about their fellow humans.
Yeah, she actually like looked away and she just bawled, which kind of like surprised me. And then I thought, yeah, doctors go through this. Like the human side. You guys are you're human.
I could not imagine doing her job, or the job of like my preferred home euthanasia vet. I hate that I have a preferred home euthanasia vet,
Oh,
but
really?
yeah, but there is like, I think for them, it is providing a service that is, even it's the hardest thing for them to do. I think they're doing something that they probably see and I see as kindly. Like they are doing their part to ease suffering. And there's got to be a lot of good things that come from that, having that mission that you do, even though it's hard. Like I remember back when I was in training, I had trained at just a medium-sized hospital, I would say. It wasn't my residency. And we had an inpatient pediatric service there that was very small. It just was not a lot of pediatric patients that were being hospitalized there. And, but all the inpatient pediatric patients were all essentially the hematology oncology children. And so who was watching over them was the staff pediatric hematologist oncologist. And, I would have to rotate through that and I would have to take care of patients on that floor. And, I would walk in there and look at the names on the board and they would all be her patients. And I remember thinking, oh my gosh, that is a very, very, she's this lonely, grim captain of a very sad ship, you know, like I remember thinking, holy smokes, like this is just, but at the same time, I think she got a lot of joy out of that in that she knew that she was doing the very best she could for those children and their
Yeah.
families. And I think that's how I would have to probably deal with it if I was doing a job like the home euthanasia vet. That it's like, hey, like, and also I'm going to guess that it's not likely. It's okay. I'm making a lot of broad assumptions, right? Which we should not do, but I don't imagine these services, at least for me, where I live, are not cheap. They're very expensive.
Very
And
expensive.
so, yes. And, I don't necessarily think, in all honesty, I want the one I work with and have worked with and have recommended locally, I want her to make this lucrative for her. I hope she has a comfortable retirement, that type of stuff,
Yeah.
that she can pay her bills and feed her family and all those things because the service that she provides is so helpful, but I have a feeling that because of that, you're usually not, people who don't take good care of the pets they have are just gonna not do anything, or they're gonna be like, oh, I don't know, the dog looked funny and he walked out the door and I don't know what happened to him. Like there's a lot of people who are not really careful with their pets. They just view them as objects and so I'm imagining that a lot of these vets are only seeing people who genuinely care about their animals and
Yeah.
are, you know what I mean? So I'm going to get, even though it's not really great, that most of the pets she's seeing are not victims of abuse.
Yeah.
They're victims of disease that can't be maintained any longer. And so that's kind of nice. I mean, it's like you're not having to see maybe some of the stuff you would see if you were working in an office,
Yeah. I mean, sharing with you as a patient or as a dog owner, and even the caregiver to my sister, right? Like, my sister. It was an honor. I have to say that word it was an honor that I was able to give them kind of that way that
They
way
were
to go.
given they were given loving care by somebody who loved them, and that is
Yeah.
probably the most beautiful thing there can be.
Yeah. And your dogs have had a wonderful life, absolutely loved and spoiled and incredible attention given to them. So they had a
Yeah.
good life. Yeah.
Yeah. I mean, like,
But also, yeah,
I'm sure for
you
you
spent
guys,
time with them.
it must be an honor. I hope that both of you and all the doctors that may listen to this, that I hope that you would feel a little bit of, an honor to either, to bring someone, into this world, to be able to save their lives and to be there as, at the end of their life.
Yeah.
That's one of the beauties
It
of,
is.
I mean, that's one thing that's always appealed to me with primary care, which I do, which is I see them from the beginning and I can see them at the end.
Yeah.
Yeah.
And so
You get
here
to
I
be there
am,
with their journey.
here I am crying with, the loss of my dog, but really, I look at it as, it was a gift.
Yeah.
I was, we were talking about it, like, what a pleasure, like in the arc of my life to have had this perfect dog, so that
He was so
it,
sweet. He was adorable.
it was fine. It was good, and, here we were talking about, as you guys as doctors, um, you know, bringing life in, preserving life, and when that life ends, right?
Yes.
Kind of a
But,
sad,
and you
huh?
know that you can call on us if you need us. These are hard times.
Definitely.
We're always
Right?
here for you.
Definitely.
So that means that you have to survive me, okay?
And if you ever want to borrow a dog, my dog is available. I very much
Rental pet.
yesterday, I was home alone with him all day yesterday, and it was very bad weather for us here, so he couldn't go outside. And so he was driving me nuts. And I found myself like yelling at him to just like, quiet, leave me alone. And every time I did, then I felt bad because I knew exactly at that moment what you were going through. And then I'm like, okay, I can't be mean to him, but it's like I love him, but then I hate him, but then I love him, and then I hate him again.
That's when it's that's when it's time to put him back on the treadmill.
Yeah, we
Right?
did. We went on the treadmill, and I tried to do
More
whatever I could.
treadmill.
But he just, they don't understand bad weather, and so
Yeah.
they, don't understand that he can't go outside, and he just stands at the door and barks and barks and barks, and I'm like, you can't go outside. It's it's bad weather now. You can't. And so he just was not getting it all day yesterday. So, and then I think being home alone with him too, it was just me, like versus having other people in the house, then he, got some other attention from people. So anyway, if you want a big fat dog who will, make you be like,
I'm the big fat dog here.
no,
No,
no, no. This dog weighs more than you. This
I
is
know.
big, fat, lazy dog who just wants to sit and
The
eat,
best.
cuddle, and all of that. So yeah, you're welcome to borrow him.
I think also on the other side of losing, someone you love and caring for them, even for me, like, it was just the last 3 days. It's also waking up the next day. I woke up today, except for this darn daylight savings, but I didn't have to go out, to get him out. I didn't have to prepare, put food on the floor.
It's
There
okay
were,
it's okay to be relieved also. That's
yes,
okay.
just that
It's okay
relief.
to be like, I don't have to worry about him now. I don't have to worry about, is he in pain? Does he need his medicine? Like, how are we going to get him to eat? Like, it's okay to be relieved,
Yeah,
to
yeah,
not have those worries anymore.
yeah. And it's like the last few days. Again, he gave me that gift of just, he only gave me like 3 days of worries. And, I'd wake up in the middle of the night. Every movement he made, I'd wake up. So I'm a little bit like lack of sleep. And then last night, I'm just like, I slept through it. I was like, oh, and I've gone through this with a human being, but I think, as I've told others, I'm sad, but I'm not devastated.
That's good.
It's a
And also, I mean, pets have a limited lifespan
yeah,
generally, and I know I sometimes think the next pet I'll get like a parrot or something that I'll have to will to somebody else, but then I think I don't really want to do that because how do I know that they're going to be taken care of?
exactly. Yeah. So for those that, the one person that listening, it's listening to us, well, we'll say four, you know, um,
Hi M, hi S.
Yeah.
I've last year, I've had a devastating year last year. I actually told this dog, I said, just give me 1 year. Just do not die on me this year. Give me a year. And you know what? That's exactly what he did.
Yeah.
So I'm
And he's
thankful
a
for
good
that.
boy all the way to the end.
He's like 16 years old.
Yeah, yeah.
Yeah.
It's pretty good.
Yeah. That's a long life for a dog. Yeah.
Yeah. And he looked good before, I didn't want him to like to lose weight, lose fat, to deteriorate. I said when he goes, I want him to, you know, to go just as I would remember him. That's just as how he would have loved to go. And
Going at just the right time. Like, lived every day you could, and now that it wasn't good, now we're done.
yeah, yeah. And I said so. I always think about like what people or dogs their last meal. I gave him a little bit of my good butter. Oh, he was refusing to eat like the last 2 days.
Uh-huh.
And for a small dog, that's bad.
Yeah.
But an hour before the vet came, he licked that butter. He ate that butter. I'm like, yeah, okay,
Oh.
check it out, full life, And so that's kind of what I experienced. On to a future dog to take care of.
Yep. The best way to pay tribute to that dog is to take care of another one that needs a
Yeah,
good home.
yeah. Later, And now I'll be able to travel a little bit more. Just as one more dog left here. So that's
Yeah.
also the flip side, right?
Yeah. Give yourself some time for sure.
And it's the surviving. Um, you guys must deal with like the families, or do they call you? Do you talk to them after that, or
Depends. I think it's probably different for Dr. Ray because I don't know if she's seeing these problems early in a lifespan, but if say I'm guessing, if you have a person who loses a pregnancy, but she still needs obstetrical care and may have future pregnancies, and so Dr. Ray will continue to see her. For me, I'm just thinking back over time. It depends. I've had situations where I care for both the spouses and then one of the spouses dies. And then I've had situations where I have patients that pass and I don't know the family or I've
Yeah.
never met the family,
Yeah.
or in some cases where they were like the family was very involved in the caretaking and there's definitely communications afterwards, but
Hmm.
um
As a family member, I haven't called my sister's doctors.
Oh, you don't need to. I would not expect that.
Mm.
I would not expect that from family members to call me for any reason other than, in the initial time. For me, I usually just talk to the patient or the patient and the father of the baby. Occasionally, if the father's out of the picture, maybe the patient's mother is in the picture, and so then
Mm-hmm.
it's them that I talk to, and that's about it. But I've had obviously have had patients who have, been older and who have died for various reasons, or maybe they had other reasons. But I don't expect phone calls from people to tell me, I had this, very lovely couple that were in their 80s, and I was seeing the wife every 3 months for an issue. And every time they came in, they were just, the cutest grandparent couples, and just talked to you like they were your grandparents, and, asked me about my life and asked me about the dog and asked me about all these different things. And when they would come back, they would remember and kind of pick up that conversation. If I told them like, oh, my son has a soccer tournament this weekend, when I saw him in 3 months, they would be like, how was that soccer tournament? And I'd be like, what are you talking about? I don't remember the soccer tournament, but they do. Or they'd come back and ask me how something happened with my dog. Like, did he do it again or something? And just the sweetest couple. And every 3 months I would see them. And then, I kind of thought to myself, hey, it's kind of been a while since I've seen that couple. And then kind of forgot about it and thought about it another month or two later. And I was like, yeah, it's been a while since I've seen them. And then looked to see, and, it was maybe 6+ months since I'd seen them. And then you kind of just get this feeling that, maybe that's what happened. And then they never came back, and so you just realize, she was like 84 or 85, and at some
Yeah.
point, that was going to be it. And, you know, um, maybe it might be nice to just get a phone call to say that they passed away, so that we can just kind of close their chart and know not to like call or pester, people, or I don't, like if they're due for an appointment, we're not going to call and be like, so and so needs an appointment. And then I don't want to have somebody be like, well, they died 2 months ago or something. And then definitely if they, owe some money, I don't want people to be calling them to be like, you owe us money type of a thing. So
Yeah.
that might be nice to just get a call saying, just letting you know that she passed, but that's it. But that's
Well,
usually for the admin staff, not for me.
I have a question regarding that. Could I call her primary care and her OB-GYN and get her records? Is that allowed?
You would
I
have
don't know how
to,
that works.
be, I believe it is, but you would have to have, like her executor of her estate or power
Uh-huh.
of attorney.
Yeah, which I am.
Yeah, then I think you can. Then you just need to sign the appropriate medical record release forms and stating who you were, and then you can get a copy.
Oh, that's good. That's good to know. Okay.
I don't know how that works after somebody passes.
But I think
Yeah, I don't
if
know.
you are executor of their estate, or you had their legal power of attorney
Mm-hmm.
or healthcare directives, then I think you can. As long as you are, legally allowed to legally be in charge of their affairs posthumously. But
And
just counseling you as a friend, I don't think there's any reason you would need to get them.
mm,
I don't think there's a purpose. in that, or a reason to.
Well, just understanding if maybe she had something that maybe I'll have.
I would hope that they would tell you that in some way, I would, if I were in a situation like that, where if I was, the cancer specialist taking care of a patient who was terminal, I'd be like, hey, can we talk about this with your family because we want to make sure this doesn't impact. I mean, I would try to figure out a way to do that, but
I would think, though, usually if they're in that terminal situation, the family is there with them and probably at the visit, and they, in that situation, they can be telling them, in
having discussions
what
openly.
the situation is. Yeah. So, for example, if your sister had been, some other place and by herself and never told anyone she was in the hospital, and then she just passed away in the hospital and you never got any reason why or anything like that, then that would be, a reason to want her to maybe look at her records and try and speak with a doctor and find out, what happened to her, because obviously knowing what happened, then it affects your health as well. But you didn't have that relationship. So she, she shared, what was going on. Everyone, knew and knew what, your potential involvement would be as a sibling. So yeah, I think that, the doctors, because you were there, I think they told you everything that you needed to know. I don't think there's something going to be in her past records,
But seeing she lived in another city, so and I know, she has her primary and she has her OB-GYN that she was going to see,
Yeah.
They probably don't know if because it was all kind of spread out in different places.
But
see,
could I
I
call,
think that
for example, Dr.
call
Foss,
them.
if I called
Yeah.
you and said, here's her death certificate and here's the legal paperwork that I'm her executor and responsible for her estate, and I'm her sister, could I get a copy of her medical records? And then same thing with Dr. Ray.
Well, I mean, I think if I have some, I would. Honestly, when it comes to posthumous stuff, I don't know because I've never dealt with that, and that's never. We always talk about don't release records and HIPAA and privacy and all those things, but that's never been in reference to death. And certain records become public, but not medical records on passing, right? But honestly, I know how this sounds, but I'd be like, somebody's going to sue me. They're looking for a reason to sue me. Is the first thing I would think.
I would think the same too.
I would not be like, oh, they're just curious. Like somebody's mad. And somebody's doing everything with a fine tooth comb to figure out a reason to hold somebody responsible because either somebody should be held responsible or because somebody is hurting. I see a hand up for Auntie.
Yes, go ahead, Auntie.
So this conversation actually made me do a quick Google search because I was very curious to see what I would be able to find. Because I know when it comes to HIPAA, it's very, very strict.
Yeah.
So when it comes to health professionals. So what I've learned, it says an executor or administrator of the state is considered a personal representative under HIPAA, granting them legal authority to access a deceased person's protected health information or PHI for 50 years after death. And they step into the shoes of the descendant to manage the medical bills, claims, but it goes on to say what documentation is required. It says usually require proof of authority such as letters, testamentary, letters of administration, or small estate affidavit.
Right. Basically,
but it's usually known to,
the right to sign. Yeah.
Right, and it says why this would be necessary only to cover for medical records necessary to settle the estate, but for no other purpose is what I'm looking at.
So not for personal knowledge. It would have to be associated with I need this information to close this estate. And so that's curious. Well, I mean, that in some ways I kind of sort of agree with that because I think a patient is entitled to privacy. And if they didn't want, if they told their doctor, if you have a husband who died and then it turns out that he's coming in to see his primary and getting, don't ask me how I know these things, all kinds of STI testing because he's got action on the side. And then, you know what I mean? It's that's, I mean, I don't know.
Do they
you get
have
into the
the? Does that husband have the right to privacy if he's dead already?
see, that's the thing, but it's I think they do because
Yeah.
that was care that was sought in confidence. So I don't know if that's necessary. But now if there's issues related to billing because of those, and now the wife has to settle bills because of that, then and
Hmm.
she, what was the reason for the visit? Then I can see where that. At the same time, are you entitled to those details? So it gets into this. I don't really want to talk about these issues things. I don't want to
Fascinating.
know. I
Yeah.
don't really want to know.
Yeah. Fascinating. Fascinating topic that we got into.
Well, when we talked about like, end of life stuff. So when I've had patients who've passed, I generally will notify their specialist. Like I'll call the specialist and be like, hey, you need to know that so and so, passed away. And I actually did that not too long ago with one of my previous place of employment, and the specialist was completely devastated, like shocked and just like what, like and just lost their business. And I'm like, I know, I at the same time I was like, well, I'm not surprised. Like I'm not, I don't agree. I'm not happy that it happened, but I'm not surprised. It's like, why are you so surprised? Like you're the specialist. Like this person wasn't exactly compliant with all these serious problems. Like, and then also, I think for me as a primary care physician, like the whole cradle to grave kind of attitude was like, I started doing this. Like I remember very clearly my mentor in when I was in medical school, who kind of piqued my interest in this, who was a really, really awesome person. And, I kept in touch with that person until fairly recently when I think the pandemic kind of upended everything. I should send them an email and see how they're doing. Um, but it's funny because at that time there was a lot more private practice. And so a lot of doctors would set up shop somewhere and that's where you practiced and then you retired and then you moved on and, you had all that in there. Now there's a lot of, there's a lot of corporate medicine, private practice, I think, especially in certain parts of the country is not as where you have your own practice and you do your own hiring and firing and you have your own medical records and you may have an affiliation with a hospital and all those things, but you were, a private physician, you called the shots. And now, a lot of people work for corporate entities. And so because of that, there's a lot of job hopping too. Like I see that more in medicine than I think I imagined when I was a younger physician, just like anything else. I mean, people get a job and they're like, I'm not happy here. There's a management change or this and that. And then they move on to something else, even groups where you'd imagine. I had a friend of mine who's a hospitalist, and I saw her do that several times because she'd find a job at a hospital and she liked her group and she liked the administration and she liked her work, was very happy. And then the medical group is bought out by somebody else. And now there's new management and, that's never, it's never a good thing in medicine. And then they would come in and say, okay, we're keeping all of you doctors, but we're going to slash your pay by 25%. Okay. Cause we're the new management. So enjoy 75 cents on the dollar what you've been making. Who stays for that?
Right.
Like who
Right.
stays for that?
So
People would
how
be like, yeah, peace out. I'm going to find another job. And so I've done that. I've hopped around a lot. So unfortunately, I can't sit here and say, oh yeah, there's been tons of patients that I've had for, 20 years and then they reached the end of their life and that was it. I mean, there's really only been a handful of patients that I've lost because I think the longest I ever stayed anywhere was maybe approaching 10 years, because it's just, there's changes and you leave.
how realistic or impossible is it if I were to take both of you, to Hawaii and let's just like start a new practice
Well,
and retire there?
uh,
Is that like just
it's,
No, we could. I
I
mean,
think
there's no
about,
reason we couldn't do that. We have to get licenses in Hawaii, and we would have to, go through the process of opening the practice and meeting all of the, um, you know, criteria that we need to do as far as licensing goes. You need lab certificates, OSHA, stuff like that, and buying all the
yeah,
equipment, investing all of that in,
you
and
have to
then
lease a space. You have
yeah,
to enter into a network.
yeah,
So
Contract with
country,
insurance companies.
you would have to establish a contract with insurance companies so that you could be within network. You would have to decide what kind of patients you want to see. Is it everybody who comes in the door, cash pay, HMO?
But
Um,
that's doable
you
now.
know,
I mean, that's what I'm asking. Is
It's
that
doable. Yeah, it's a lot of work, but
it's a
it's
lot of work.
yeah.
Yeah.
But do they want to do it is a better question.
I
You
mean,
know what?
Hawaii.
In a fantasy world, yes. Like in a fantasy world, straight up. Like, yeah, that sounds cool. I could work with like people that I love already and, like to live in a place that's like, I think in a beautiful part of the world. But I mean, is it practical? And as our host knows, nobody on this call is 21 anymore.
Right.
we
Yeah.
could look 21 in our minds? But okay. So I mean
And
that's
then
more
things
of the
like, it's
business
like, yeah,
side of things.
I would love it, but like, do I really want to leave where I live? I don't know. It's like, it's not easy. Once again, if I was a younger physician with fewer encumbrances, I
Mhm.
would be like, what are we waiting for?
Mhm. Okay. All right. All
However,
right.
if you decide to do that, don't forget to leave me out. Don't leave me out. Make sure that you talk to me, because I'm not saying no.
I mean, of course, the grass is greener on the other side, But I'm just curious how possible, and with what you mentioned, the change into corporate medicine. If you had like a big social media following, and then you reopen a
Hmm.
new practice.
You know, we will talk about that later. Yeah. But I mean, in a lot of ways, like I can't, there's an administrator that I've worked with over time who has become a good friend of mine who's also a former nurse, right? And this person is just like the cat's meow. She's just like a really fun person and really smart and a heck of a business person and a leader and all those things. And we have both fought like the corporate kind of garbage, right? And she actually was brought in to manage a unit of the large corporate entity that I used to be affiliated with, and that's how we got to know each other. And um, both of us have subsequently left the organization, right?
Uh-huh.
And because it's not well managed, and I could tell you later stories that would curl your hair, but I still keep in touch. We used to always have these fantasies of like, screw this corporate garbage. Let's just set up a little private practice, um, we'll just do it in my garage. A couple of good MAs and let's just take the patients that we actually enjoy working with and not the ones who are so mean to us and just let's just make a little small tiny practice where we just enjoy what we do and we'll barely be able to cover the bills, but it's joyful as opposed to
Okay.
just drudgery. So when you
But
talk about this, I'm like, you know, not a bad idea.
Dr. Ray.
Yeah, I mean, I concur.
All right. Let's change things up here. Um, social media trends for the week. Let's see if
Oh, dear.
let us know. Let me know if you've heard about it. Um,
Okay, I'm just going to tell you, probably not. I
ah,
seek to avoid these things.
the muscle as a medicine movement. There's a massive shift on social media driven by longevity experts and creators. Move
Okay,
away from
some self-professed longevity
uh
experts
some
who have been
profess
shown to not have completed their residencies and have been implicated in Epstein files.
they're a
Those individuals, those ones.
doctor, yeah, they're doctor online. Moving away from weight loss towards muscle mass as a metabolic marker.
Yep, legit in some ways. But I'm afraid that that type of thing opens the door to body dysmorphia and obsession and the idea that even if you are a lean, mean, muscular machine that you will never suffer any malady in the future is not true.
So explain to me, who like knows nothing, what this means.
Well, I
And
don't
me.
know exactly. I'm sorry, Auntie?
No, I was going to say and me because I don't know what it means either.
Explain to us in
Okay,
English.
so I also not paying, I don't know the exact trend, right? Because this is the type of thing I try to actively avoid. There is some legitimacy, like, muscle mass on the human body is important. I think of it, it represents kind of like money in the bank. You want good muscle mass, not a lot of adipose tissue because metabolically it's healthier. That means you're getting enough physical activity, that it means that you're meeting your nutritional needs. Muscle mass is protective of the skeletal mass underneath it. So like when you have strong quads and hamstrings and glutes and all that stuff, we're hoping that that means that you're stressing those muscles enough that you're also stressing in a good way, just like you stress muscles to grow them, right? That you're stressing your skeleton as well. So you're less likely to have things like osteoporosis.
Okay.
Muscle is metabolically different than adipose, aka fat tissue. So, you're going to have a better insulin sensitivity and hopefully a better lipid profile. So, what I am worried about is, a lot of, body image issues that we're starting to see in young men who obsess over how they look, the gym bro kind of thing, and it's like women historically obsessing with how thin they are and will go to great lengths such as anorexia and develop other eating disorders to maintain those body images. I don't want it to go the other way with
Is it
males.
true that if you start weightlifting, that um, even while you're sleeping, that as you build muscle, it's burning fat? Is that true?
I think the idea behind it is muscle mass is more metabolically active, and so your calorie requirements change. I don't know exactly how much,
Okay.
um, but I think that's kind of a somewhat accepted understanding. I've never sat there and read a randomized double-blinded trial on that, just saying.
Okay.
And having muscle mass, appropriate muscle mass, is good for you. Does that mean that you will never get sick? No. Should we, and then my bigger fear is, are we going to obsess on that? No. Should you only, how much protein should you eat, all that stuff. And those are the times when I say, you know what, probably talk to a registered dietitian so that you're not taking things too far, because too much of anything is bad for you. That's probably the biggest thing. Too much of anything. Too much exercise. Like, too much can hurt you, right? Even professional athletes are not exercising continuously and have trainers and registered dietitians and doctors watching over them so they don't overdo it, right? So and then, then I worry about things like testosterone abuse and all those things, trying to achieve a certain look or the obsessions that come out of it.
Wow. Okay. Next
So
one.
basically, stay fit, eat healthy, don't go too far.
Wow. That's boring. Because that's what they've been saying since day one.
Well, really, are you going to take medical advice from the general public?
All
Like, I
right.
would be,
There you
no.
go. There's that clip.
That's what social media is as a general public. And here's the other thing too. I'm going to say it too. All these, well, I read it in this book written by a doctor. Okay, popular media book that you would go buy on Amazon, and in the old days you would go buy at the bookstore down the street. That person, that's not a textbook. Anybody could write a book. I could write a book too and get it published. But that doesn't mean, as long as I have the right marketing and as long as I sound like I know what I'm doing, that doesn't mean it's right. It doesn't mean any of that stuff. And so it's the same thing with social media personalities. I don't know them all. I don't know hardly any of them, and I don't really want to. But it's like, hey, if you need to are you doing this as like a public health campaign, or are you doing this because it gets you advertisers and followers and influence and money?
Mm-hmm. Right.
Like,
Okay.
what's
We could have
if you have
we could have a whole topic on doctor influencers.
Totally.
Ooh.
But it's also like it's the same thing. It's like, well, I read this book and this doctor, he was a doctor and he wrote it. Okay, great. That's not the same thing as an accepted medical textbook.
Yeah.
That's peer reviewed, and you have, I just anybody can say anything, and it doesn't mean there's any legitimacy to it,
So
including me. You guys
we
can
have
think I'm a total moron, and that would be your prerogative.
well, we have here in the chat. Dr. Foz's book would be 100% right.
Right, because
And I said what I said.
she is a moral person, not looking for monetary gain. Yeah.
Yeah, we in our research we noticed that the top topic on social media right now are from influencers or creators who talk about longevity.
Oh, don't get me started.
Yeah.
Do not get me started on that. I mean, it's like all these ridiculous things because do you think we in medicine, like who practice traditional, regular, like evidence-based modern medicine are trying to withhold any of that stuff from our patients? That's absurd. Like, if you think that, then you have bigger problems.
There you go. As I
And
love
then once again, the social media is merely public opinion. Has that often been right? Or something that you want to follow or listen to?
there you go. And I'm stealing. This is Auntie's copyright. Regular, degular. Okay, next one. Social media trends. GLP-1 expansion. Beyond Ozempic, the conversations have shifted to orforglipron. How do you pronounce that? Whatever. An oral version of these weight loss drugs. People are closely following its clinical progress as it promises the same benefits without the weekly needle. Thoughts on that?
There's oral GLP-1s that are on the market and have been on the market for a long time.
Oh,
There was no indications though for weight management. It was strictly for diabetes management. And so that's why that hasn't really come up. And then it isn't the end all and be all of things. And there's been changes in that. There's been a reformulation of that product, in December of last year. So just a couple months ago. So, but oral GLP-1 receptor agonists are not new. They were just not widely available because it wasn't for weight management. It's for diabetes only.
got it. All right, last one. This one is microbiome personalization. The gut health trend has evolved. Instead of general probiotics, the focus is now on precision sequencing, using home kits to map your specific bacterial strains to tailor your diet. What's that?
Okay. Trends. When there's a trend,
I'm not.
no. There's a lot of talk and a lot of stuff about gut microbiomes and how they may affect things like obesity and just general health, but I don't think there's a lot of accepted data out there that doing this is all that helpful, because if it were, I would be recommending it.
Mm.
So it's kind of, is this something that'll change in the next 10 years? Maybe. I don't know.
Interesting. Good feedback. All right. That's it. That's all I have.
Sounds good.
That's a lot.
Yeah.
That's a lot. And Auntie, you have any questions, comments?
No, I'm just like really blown away by the conversation that we had today.
I think we can't even title our sessions because we don't talk about anything that has to do with the topic. I think we just go stream of consciousness, whatever topic pops up, and just talking. I mean, and that's, I guess, what the podcast is about. Just,
Yeah.
Talking about stuff.
hearing the truth from some doctors,
Well, did you see my title? Who let the dogs out?
Yeah, I'm just like, I don't think
That's my every week title.
we never stay on topic.
All right, I want to ask you some celebrity health news then. Ray J's heart health. Singer Ray J has been candid. What? Dr. Foss, what'd you say?
Who and what?
What is that? Repeat what you said?
Auntie.
Look, I love the idea. The fact that you ladies do not know who Ray J is, please keep it that way. Keep it that
I
way.
actually do know who Ray J is, unfortunately, but
Yeah.
like, isn't that like somebody that's a D-lister, right?
Probably.
I
didn't get what the topic or what the comment was about.
All right. Let me read through it. Singer Ray J has been candid on social media about his recovery from severe pneumonia, revealing that his heart is currently functioning at 25%. He's been documenting.
Okay, so he has heart failure.
Huh?
He has heart failure, if that's what that's. I mean, the average physician would interpret that as heart failure. Do you agree with that, Dr. Ray?
Yeah, isn't it supposed to be? Did you say ejection fraction was 25%?
No, they just said the heart is, quote, functioning at 25%. Does that mean he can only love people 25%, or his blood is only being pumped at 25%?
I believe that's probably ejection fraction, which I think normally should be 6%.
That's what I'm guessing.
But go
ahead.
What
does that mean in English?
It means the volume that the blood is pumping out.
Yeah, the heart has to push out a certain amount of blood. It's called an ejection fraction. And it gives us an idea to something called heart failure, which is when the heart is too weak to pump blood forward.
You can get that from pneumonia?
Well, I mean, that would be, yes, you can, but that's not a direct, like, we're talking a very convoluted situation.
Okay.
So, I mean, that's very vague, as I would tell you. I couldn't.
Now, if your heart is functioning at 25%, like, give us an idea, like, what? I mean, are you supposed to be pale, anemic?
If you're having you'll have swelling of your ankles.
Yeah.
And you'll wake up at night short of breath. All of a sudden, you won't be able to lay flat. You'll have to sit up to sleep. You will be very weak and pale looking and, basically short of breath all the time. And that's assuming you have typical, what we call, HFrEF, which is heart failure with reduced ejection fraction.
Can that be healed?
No. Medications can possibly help, but I don't think so.
Yes and no. I mean, heart failure is not a great diagnosis to have. The mortality rate of heart failure, the 5-year survival rate of heart failure is 50%. So what that means is somebody's diagnosed with heart failure, the chances of passing away in the next 5 years is 1 out of 2. So it is not a good diagnosis to have. There's different types of heart failure though, and they don't all have the same prognosis, I should say. So I don't know what he means by saying his heart only works 25%.
So
I can elaborate a little bit because we have talked about Ray J so much on my show that my co-hosts are like, please don't bring up another Ray J topic, please. But what he's saying is that due to years of heavy drinking and heavy smoking, is that his heart is basically black now and is working at 15. First he said 15 and then went on to 25% capacity and is not pumping blood as he should. He should be getting rest, but he's not able to because he has a manager that makes him go on stage, even though he does have these. No one actually believed Ray J at first until his mother recently came out and said, "Hey, wait a minute, it is actually very serious, and we're concerned." So they're actually not expecting him to live. Past another year. Mm-hmm.
He's young though, right? I mean, he's got to be 40,
like
45,
in his 40s, maybe mid 40s, I believe.
That's terrible. So what happens is there's different types of heart failure and there's different reasons. Some of them are genetic. So sometimes people are born with a defect in their heart that can lead to heart failure. Sometimes, so that's one type. Most of the time in the medical community, when we're talking about heart failure, we're usually referring to something called HFrEF, which is heart failure with reduced ejection fraction. And that's most commonly due to heart muscle damage from previous heart attacks. So insufficient blood flow kills off some of the muscle that it doesn't move very well. So um, there he is.
Yeah, we just posted a photo of Ray J.
So there is medical management. There should be medical maximization of therapy to help reduce the impact on patients. There's beta blockers and there is ACE inhibitors and ARB medications and there is um, uh, SGLT2 inhibitors and all these things that should be done to protect the patient. And then activities as per what the cardiologist directs, and then correction of ischemia. But you can have these things happen from so when I was a younger person, there was somebody that I knew in college years, but we did not go to school together. This was I would describe it as a friend of a friend. And this person is really smart. I met him when we were in our university years, but this person developed a significant drug habit, and was really into stimulants.
Oh, I know who he is. Not kidding.
Yeah,
Yeah. Go on.
smoked a lot of cigarettes, drank
Don't let me
tons of
distract.
caffeine, I don't know how much, probably a half a gallon of coffee a day kind of stuff.
Wow.
I know dabbled in speed. I know dabbled in coke and crack and other things that I would not recommend. And had some baseline pre-existing health issues that I don't know all the nature of. I'm going to say that, to be fair. I don't know what else. And I knew this person peripherally and was really smart, was like an electrical engineer candidate and went to a top rated university for this. And he came from an underserved background and couldn't afford to go to school, couldn't afford to pay the bills, and basically had to stop schooling very close to the end of his degree, which I thought was one of the most tragic things. And then just kind of started living the life, but it always, kind of dabbled in drugs and always smoked cigarettes and all those things. And all of a sudden died one day at a young age. And an autopsy was performed because this was not expected. And his only finding was an enlarged heart. And I have a friend who is a forensic pathologist, and my friend was basically, that's all you need. If you don't know why somebody died and you find out that you open up the chest cavity and you find an enlarged heart, the autopsy can end right there. That's all you need. So he probably died of an enlarged thickened heart from chronic hypertension, and that's what I'm guessing, and it just triggered a fatal heart rhythm disturbance. I don't know what else may have been found, and it's still a very sad thing. It's one of those things where a mind is a terrible thing to waste. This person could have contributed a lot to the world. Very smart, but just had issues. And so, I don't know, Hollywood is rife with these things. And so I don't know if there's substance abuse involved. Ray J is an underrepresented minority as well. And so he is at risk for hypertension and stroke and glaucoma and all those things that I hope somebody was paying close attention to. And you can also have things like alcoholic cardiomyopathy that absolutely can happen. There's a million things that can cause these things. And I just hope that he is able to take good care of his health and follow his doctor's orders and is getting good care.
Stop going on stage, right?
We got to pay the bills.
Well, he can't. His manager said, no, get your behind on stage. I don't care where you're bleeding from. Get on stage.
What?
Well, but see, the thing is I don't understand that. Who's really controlling the situation here? Why is your manager able to tell you that? It's hey, I'm dying. I'm not getting on that stage. It's that's absurd. I can't imagine. It's like if you have a very, like a prized thoroughbred racehorse that brings you home winning purses, you're not going to abuse that racehorse. You're going to make sure that racehorse gets the best care possible.
Right.
So what's going on here? I kind of don't believe that.
I've reached out to Melinda Santiago. So far, no word back.
Melinda Santiago.
Yeah,
That's his manager.
oh, okay.
Oh. Well, darn it.
Well,
I want to know.
if you want to learn more about Ray J,
Okay, but see, okay, I have to say it. And this is why, America, control your blood pressure, okay? Because you don't want this to happen.